Mandibular and condylar movements, a combination of movements in the sagittal, frontal, and horizontal planes, are complex and difficult to study. During jaw movements, the mandibular condyles rotate and translate as the jaw opens and closes. There is a lateral bodily movement of the mandible and condyles called Bennett shift during chewing. The objectives of this program are to examine the pathway of motion in both the sagittal and frontal plane as the mandible opens from centric occlusion to about 20 millimeters and then returns to centric occlusion. Examine the pathway of mandibular movement in the sagittal plane from centric relation to maximum opening, to closure in protrusion, and then retruded to centric occlusion. Examine the pathway of motion while chewing and swallowing a fibrous food. Examine the velocity and duration of a single chewing cycle. Describe masticatory muscle tension and contractile activity during a single open-closing cycle. We will use a specially designed kinesiograph and headgear fitted with transducers. A magnet with adhesive is attached across the midline to the labial surface of the lower anterior teeth. It is placed as close to the gingival margin as possible. A frame which contains 5 magnetic sensors is placed securely on the subject's head. As the mandible moves vertically, laterally, anteriorly, or posteriorly, the sensors track the magnet. Mandibular movements in the sagittal and frontal views are displayed on the oscilloscope. The subject closes into... The oscilloscope is calibrated to 5 millimeters of mandibular opening, which is represented by 1 division on the oscilloscope screen. The oscilloscope traces movement both laterally and vertically. Mandibular movements in the sagittal and frontal views are displayed on the oscilloscope. The subject closes into centric occlusion and slowly opens about 20 millimeters or 4 divisions. Mandibular movement in the frontal view should be vertical along the midline. Lateral movement to the right or left in the frontal view indicates a deflection in mandibular opening. When viewed in the sagittal plane, the mandible moves anteriorly back to centric occlusion. The subject closes into centric occlusion and is guided to centric relation. The mandible is opened along a hinge axis of opening. Upon opening, the subject protrudes the mandible and closes to tooth contact. With the teeth contacting, the mandible retrudes to centric occlusion. Observe that the subject has traced the border envelope of motion in a sagittal plane. However, the subject did not open maximally in a vertical path because the kinesiograph is limited in tracking the mandible with maximal jaw opening. The subject is given about 2 grams of chopped apple and will chew normally on the posterior teeth on the right side. 3 cyclic chewing movements will be made, and the subject will be instructed to stop in occlusion. The duration and excursion of the masticatory cycles are larger at the beginning of mastication. However, as the apple is reduced in size by occlusal forces, the masticatory excursions become smaller. The subject returns to centric occlusion with each cycle. When chewing on the right side, the subject opens the mandible vertically near the midline. As closing commences, the mandible moves laterally to the chewing side and continues in a lateral orientation as the mandible returns to centric occlusion. The subject is now given 2 grams of chopped apple and instructed to chew on the left side. 3 cyclic chewing movements will be made, and the subject will be instructed to stop in centric occlusion. Differences in excursion are noted. The most apparent difference is the lateral movement of the mandible to the left during closure. The subject will select a preferred side and chew 2 grams of chopped apple until mastication is complete. The subject will swallow the bolus. Which side did the subject prefer to chew on? Compare the chewing cycles of the preferred and non-preferred sides with respect to mandibular movement. The kinesiograph is set to examine mandibular opening in the frontal view and determine the approximate velocity of jaw opening and closing. The subject opens and closes slowly. The velocity of movement is estimated by noting that 1 division on the scope equals 100 millimeters per second of mandibular movement. The subject now opens and closes as rapidly as possible. The estimated midpoint opening velocity is 125 millimeters per second, while the estimated midpoint closing velocity is 175 millimeters per second. During a single masticatory cycle, the mandible does not move with constant velocity, but reaches the greatest velocity soon after the beginning of the opening and closing movements. The duration of a single chewing cycle averages 6/10 seconds, but will range between 4/10 to 8/10 seconds. The velocity of mandibular movements will vary between 1 millimeter per second up to 250 millimeters per second. There is considerable variability in the pattern and timing of masticatory cycles during chewing. It depends on the type and consistency of the food, as well as individual variation. However, the general shape of masticatory cycles are similar. A characteristic pattern is recorded in the sagittal and frontal plane during border, non-restricted mandibular movements. Normal mandibular movements occur within the framework of reproducible border movements. The muscles of mastication contract and develop tension during masticatory movements. The tension and force that these muscles generate depends on their length and therefore upon mandibular position. During mandibular opening, the mandibular depressor muscles contract isotonically while elevator muscles relax. The depressor muscles contract isometrically at maximum opening. During mandible closure, the mandibular elevator contracts isotonically while the depressors relax until the teeth make light contact. The elevator muscles are in isometric contraction during tooth contact and centric occlusion. A disorder in any masticatory muscles can cause an uncoordinated masticatory movement. In conclusion, an understanding of the mandibular movement patterns is important to the dentist. One of the clinical goals for restoring correct occlusion is to recognize that tooth contact is integrated with mandibular movements during chewing and swallowing. Mandibular opening and closing movements in the frontal plane demonstrate considerable variation because they are small, forward and backward lateral movements that take place before, during, and after tooth contact. The mandible can be positioned in the most retruded, protruded, or lateral positions during jaw opening or closing, but these border positions rarely occur during normal mandibular movements. During jaw opening and closing, the mandible moves with inconsistent velocity. The maximum velocity occurs soon after opening and about halfway during closing. The slowest velocity occurs just before tooth contact and maximum intercuspation. Chewing cycles are variable both in the pattern and timing of movements. The cycles are usually longer when food is first masticated. As the food is reduced in size and changed in texture by saliva, the cycles are reduced and become less variable. Unilateral chewing movements in the frontal plane usually begin with an almost vertical or midline opening with a deviation of the jaw to the working side during closure.